If you've noticed your healthcare bills getting harder to manage, you're definitely not alone. A 2025 national survey found that roughly 1 in 3 American adults, that's over 82 million people, have cut back on basic expenses like utilities and groceries just to afford medical care. And it's not just lower-income households feeling the squeeze. Even families earning over $90,000 a year are making sacrifices, and some Americans say rising healthcare costs have caused them to delay retirement, hold off on buying a home, or put off starting a family. This isn't just a health issue anymore, it's reshaping how millions of people live their everyday lives. A big part of what's driving this right now is what happened with the Affordable Care Act. Enhanced tax credits that helped millions of Americans afford their health insurance expired, and Congress didn't renew them. As a result, many people on ACA marketplace plans saw their premiums jump significantly in 2026, with about 80% of returning enrollees reporting higher costs, and half saying costs are a lot higher. Over 1 million fewer people signed up for ACA coverage this year compared to last, and some who stayed had to switch to plans with higher deductibles and less coverage just to keep premiums manageable. Beyond the ACA, there are bigger forces at play. The US already spends nearly twice as much per person on prescription drugs compared to other developed countries. Hospital costs are rising. AI tools are actually making billing more expensive by flagging visits as higher complexity. And upcoming cuts to Medicaid, estimated to affect around 10 million people losing coverage, are expected to create even more pressure on families, providers, and state budgets starting in 2027. The government is trying some things, like pushing for more price transparency and negotiating some drug prices, but experts say broad relief isn't expected anytime soon. So what should you take away from all this? Healthcare costs are a real and growing burden for Americans across nearly every income level, and the policy decisions being made right now, in Congress and the White House, will directly affect your coverage and your wallet. Staying informed is one of the most important things you can do. If this kind of breakdown is helpful to you, please subscribe so you never miss an update, because on topics like this, knowledge really does matter.